if you're going to use a stem cell therapy, where would hyperbaric fit? Here's the story. So now you have tissue damage, you have inflammation and cellular dysfunction in an area, and then you're going to add a whole bunch of naive stem cells to that joint, hoping that they start to shift the environment and create a healing response. The problem is that cells are often responding to the environment that they're living in. If we go ahead and add stem cell therapy to that joint, yeah, sure, certainly many of them will try to intervene and create a healing response, but so many of them could be destroyed or start to respond to the fact that you've just put these naive stem cells into an area that's urgently inflamed and dysfunctional. So to think that the cells are going to repair the environment versus the environment of that joint may have influence over those cells, that's a conversation that I think needs to be broadened in the field of regenerative medicine. This is where hyperbaric fits in. Hyperbaric has a way of reducing inflammation. We also know that hyperbaric is very healing and regenerative. So basically, you're already reducing the inflammation, you're improving the cellular ATP production of that joint, you're already starting to create a healing response, and hyperbaric also increases your body's own endogenous stem cells. So if you go through at least 20 to 40 hours of hyperbaric, you reduce the inflammation, you upregulate the healing, and you start mobilizing your own stem cells. And in the midst of that, you then do a stem cell therapy that's now adding an entire layer of more stem cells to that joint or area of the body. The likelihood that you've now created an environment that is much more conducive to healing and much more likely that that stem cell therapy is going to take and be even more effective is much, much higher.